Welcome back. With the COVID vaccine now here, many are wondering if it is safe to get vaccinated.
A recent survey shows Black Americans are less likely to trust it than others. To explain why, we're joined by research professor Dr. Kinsey Cameron and political science researcher James Druckman from Northwestern University. Thank you both so much for joining us.
Thank you.
Thank you for having us.
Let's first start off by saying why African Americans are leery of a vaccine.
Well, I can start and mention that there is certainly a history of mistrust in the African American and Black and Brown communities, and it's not just one event. You know, people often mention Tuskegee, but it's not just Tuskegee, it's Henrietta Lacks. There are reasons for this distrust, and so what we need to do is understand what it is so that we can start to address the actual distrust.
And you talk about Henrietta Lacks, let folks know she went to Johns Hopkins from vaginal bleeding, and it just became a big mess. She ended up dying soon after that.
Yes, indeed. And her cells were used for years and still are being today.
Well, James, let's talk about this discrepancy here. What was it that you expected to learn from this survey that was done back in the summer, and what surprised you most, hoping to learn how to make this a safer situation for 100% of the population?
Yeah, thank you. And so we expected there to be discrepancies by race, given what Dr. Cameron just stated. I guess what was surprising somewhat was the size of the discrepancy we found, which was about 15 to 20% in between whites' willingness to take a vaccine versus African Americans' willingness to take vaccines. And the other interesting finding was that other minority groups tended towards closer to white likelihood. So it was really African Americans that stood out as the minority group that was very hesitant to take the vaccine, with just about half of them at that point saying that they would take the vaccine. And again, those numbers track, but are even greater than the percentages you get when you look at general trust in science. Well, so there's a real challenge here.
There's a racial disparity, but there is also a great political divide with all of this. What did you make of that?
Yeah, I mean, that tracks also with virtually every other COVID attitude and behavior that we found, that there's a strong political divide between Democrats and Republicans. And so we weren't surprised by that. It will be interesting as the vaccine continues to roll out if that political divide lessens a little bit, given that there's not as much of a historic political divide when it comes to trust in science, although there is a slight one. So it will be interesting to see how that develops as well.
Professor Cameron, let's not forget to mention the history of institutional racism in the healthcare system. But now that we've got the vaccine out, we're talking about the problems, and we know that African Americans are very afraid of this. What do we do to persuade them that this is the best thing to do? Or do you believe that this is the best thing for them to do?
So what we need to do is find out what the actual concerns are and direct the messages toward those concerns. I think a lot of times in public health, we presume we know what people need to know, and so we give knowledge. And instead of merely giving knowledge, what we need to do is find out what pieces of knowledge people want or need to be able to make that decision to get the vaccine.
So what do we need to tell them?
Well, I think some of the things to mention are aspects related to, there will still be surveillance going on. We have to be, open and honest that we cannot say right now what 1 year, 5 years from now looks like in terms of what side effects we see from the vaccine. We cannot know. But what we do know is what this society looks like without a vaccine. We've been experiencing it, and it's getting worse.
And what do you foresee? What will the follow-up be as the months go on, and any of the problems and hiccups that we've experienced in disseminating this vaccine? Once that gets settled here, we have more out there. What do you think will be the end result?
Well, I certainly am hoping that the end result will be that we can reach the levels of herd immunity where we have enough people vaccinated that people are protected. I think the other thing for people to realize is the frontline healthcare providers are the ones who are being fast-tracked for the vaccine right now. So by the time it's available for a lot of other people, there will be thousands, in fact, I believe millions more of individuals who have had this vaccine, and there will be more data. We will know more. I think our messages might need to change over time as we learn more about the vaccine.
Can the two of you today say that Black Americans can trust this vaccine and safely get the vaccine? James?
I think the evidence to date would suggest that there's reason to trust the vaccine. I mean, it went through phase 3 clinical trials and went through the full regulatory process. And so I think there's every reason to have trust in the vaccine. There's no reason to not trust the vaccine. And for the reasons that Dr. Cameron mentioned, the counterfactual of not getting the vaccine looks a lot worse than what we are quite confident it will look with getting the vaccine.
Dr. Cameron?
Yes, and as Dr. Druckerman mentioned, I agree. Based on what we know now, I trust the vaccine. I'm going to encourage my parents to be getting it when they are available. And I think one thing for us to remember too is vaccines do sometimes have immediate side effects, a fever, a fatigue. That's something we've seen with a lot of other vaccines, and we need to be aware that that's going to happen, and we need to let people know so they don't immediately think somehow that could be related to COVID. It will be the body's reaction to the vaccine.
All right, thank you both. Dr. Kinsey Cameron, political science researcher James Druckman from Northwestern University. Be safe, be well.
Thank you, you as well.
Thank you.